Hello, my name's Miranda Jose and I'm the Macmillan Information and Support Service Manager at Worthing and St Richard's Hospital, and I'm here with my colleague Graham McKnight, who's one of our Macmillan cancer support workers. I'm here today just to ask him a few questions about what a support worker does and how it can benefit you and your friends and family. So, hi Graham.
Hello Miranda.
How are you?
I'm very well, thank you.
So my first question, Graham, is actually quite simple. What is your role within the hospital?
So a Macmillan support worker is here to support the nurses and doctors in what they do for our patients, but the support worker is also here for the patients themselves as well. Essentially that's what a support worker is, but there's a lot more to it than that. One of the ways in which we directly support our patients is by offering a holistic needs assessment to them, which I think I've explained in another video.
Well, that's really interesting. So there is another video that goes into more information about holistic needs assessments.
Yes, we do encourage our patients to take up the offer of a holistic needs assessment or ask for one as well, and their support workers will be happy to help them address some of those concerns and needs that we know that they'll have as cancer patients. We know that different cancer patients experience different concerns and needs over the course of their treatment pathway with us. Essentially, the support work is there to help them address those concerns and needs.
Okay. So what kind of concerns and needs do cancer patients have that they come to you with during their journey?
So people do have, as I said, they do have different concerns and needs. No two cancer patients are the same. Some of our cancer patients might have needs of a financial sort of nature. We're on hand to refer our patients to some of our financial experts, Macmillan colleagues who can help them apply for benefits or maximise what income they have, all sorts of ways in which they could be helped financially. We know that some of our patients might lose their hair over the course of their treatment with us. We can refer them for a wig voucher that the NHS either pays in full or part of the cost of a wig voucher. Some of our patients might want some emotional support. Your Macmillan support workers are there to help provide that emotional support, normally over the phone these days, but if we feel that the patient might benefit with a little bit more support in that regard, we could also refer them for some counselling. There's all sorts of ways in which a support worker can help the patient during the course of their treatment pathway with us. Excellent.
So it's more of the practical and emotional support, rather than the clinical.
Essentially, yes. So the support worker is, as a support worker, we're not clinical members of staff. We're there to help with the practical concerns and needs that patients may have during their time with us as they have their treatment, yes.
Thank you. What about friends and relatives and carers of patients? Is there any support that you can offer them?
Yes, so I've met with many patients and their relatives over the course of my time as a Macmillan support worker so far. Quite a number of relatives of patients, such as husbands or wives, or brothers or sisters, or best friends. Quite a number of them have often said, I'm doing my best to help the cancer patient, I'm doing my best to help my husband or my wife, but I feel like I'm invisible and I have my own needs and concerns as well. The support worker at Worthing or St Richard's Hospital, myself or my colleagues, can refer friends and relatives of cancer patients to a great organisation called Carers Support, who are on hand to help those friends or relatives who are there supporting the cancer patient.
Thank you. And is there anything patients can do to help improve their own well-being? Is there something that you can recommend patients can do to self-manage?
Yes, at the moment there's a big emphasis on something that we call prehab. So everyone's heard of what rehab is or what that might be, but prehab is there's a big focus on that right now. That's essentially trying to encourage our patients to look after their physical well-being prior to undergoing their treatment with us, because we know that patients who might be able to exercise regularly or eat more healthily, we know that they might experience a better outcome of their treatment with us if they're in better physical shape. And there's plenty that the support worker can do to help encourage the patients to look after themselves physically, as well as mentally, of course, but prehab is all about, I think, the physical health of the patient and how they might be able to improve essentially the outcome of their treatment with us.
So that sounds like it would be an ideal opportunity for patients to do a holistic needs assessment.
Absolutely, yes. So it might be the case that a patient says, I know what I should do, but how do I go about doing it? If they complete a holistic needs assessment, they send the results to their Macmillan support worker, myself or my colleagues, and we help them sort of order their concerns from most concerning to least concerning. And certainly if they have concerns about their physical well-being and they want some help and support around trying to get physically in better shape or to eat more healthily, the support worker can take those holistic needs assessment results. They can advise or signpost the patient onto relevant organisations, such as a great local organisation called Cancer United, which is really good at helping patients get in better physical shape in preparation for their treatment.
Thank you, Graham. That was really interesting. And patients can get in touch with you via email.
Absolutely. We have a Macmillan support worker email inbox here at the hospital that patients can email at any time should they need any help with anything at all. The support workers are here to help.
Thank you, Graham.
Thank you.